Hello, students. Welcome to another lesson on postural defects. Remember the last class we talked about lordosis, kyphosis, and scoliosis, but today we want to describe flat foot, valgus knee, and varus knee. Look at their causes and the possible treatments. Remember, we said postural defects are conditions that arise from carrying the body abnormally or from bone and muscle defects or deformities. The following are types of postural defects. We have kyphosis, lordosis, scoliosis, flat foot, valgus knee, and varus knee. Last week we talked about kyphosis, talked about lordosis, and scoliosis. But this week we are going to look at flat foot, valgus knee, and varus knee. Now let's go back to what we learned last week to refresh our minds. Remember we said kyphosis affects the spine around the chest mud region, while lordosis affects the spine around the abdominal region, which is the lumbar region, and scoliosis can affect any part of the spine, making it to have an S or a C shape. Today we'll start with flat foot, which is also known as pes planus. Flat foot is a condition where the arch of the foot is lost. If you look at the picture on your screen, you will see two different foots. You will see the normal foot and the flat foot. Now for the normal foot, you see that the arch is properly formed, while for flat foot there's almost no arch. Flat foot is common in infants between 0 to 1.5 or 2 years. Another defect that affects the foot is known as pes cavus or hollow foot. It's a situation where the arch is extremely high. Another defect on the screen is claw foot and claw toes, forming the shape of a claw. What are the causes of flat foot? Flat foot can be caused by some injuries to the Achilles tendon. As you can see, it is indicated broken bone, pregnancy. Pregnancy can make someone gain weight, and as the person gain weight, the arch sags. Obesity is another cause of flat foot. Other causes of flat foot include diseases such as cerebral palsy, diabetes, high blood pressure, and so on and so forth. Aging is another cause because the muscle of the arch or the tendon holding it sags. How do we treat flat foot, which is also known as fallen arches? Flat foot can be treated using supportive devices. These devices include insole orthotics or braces for holding the arch. Shoes can also be made for flat feet. Secondly, medication. Medication can help if the flat foot has to do with a disease. Exercises such as picking or toe curl can also be of help. Surgery is also another way to treat postural defects. Let's look at the second postural defect for the day, which is bow legs, also known as genu varum or tibia vara. This bow leg is a condition where the person's leg appears to be tilted outward. Now, this bow leg is common in children but straightens with time. Some of the causes of bow leg are rickets, which is a deficiency in vitamin D, blunt disease, which makes the bone to curve outward, Paget's disease, dwarfism, abnormal bone development, which is also known as bone dysplasia, and so on and so forth. The bow leg in children is as a result of the position that the child assumes in the womb before birth, but it straightens with time. So how is this bow leg treated? Now, there are corrective shoes for bow leg. Braces can also be used, cast in some places, surgery, and exercises such as this. Valgus knee is also known as genu-valgus. This is a defect in which the knees tilt inward while the ankles remain apart when the legs are placed together. Now, this valgus knee can be caused by osteomyelitis, which is known as bone defect, can also be caused by rickets, deficiency in vitamin D, accidents, resulting injury to the bone, improperly healed tibia fracture, skeletal dysplasia, that is abnormal bone formation, and so on and so forth. How can these be treated? Valgus knee can be treated using braces, medications and supplements, exercises, surgery.